Welcome to the session on newborn care. Babies are born cute and sensitive too. You need to take care of the newborn because they will not be able to tell you if they are uncomfortable. Newborns are often seen blue until they take their first breath into this world. They are covered in blood and vernix, a white sticky lubricant which waterproofs the baby while lying in the amniotic fluid. Once the baby is cleaned and brought to you, you may notice her to be red and a few unusual swellings which will soon settle down within 2 to 4 weeks. Some of the organs will still shape up until the end of the first year. Babies were closely held inside your womb for the 9 months since the conception. They were witnessing constant growth and were protected warmly by you. They had neither to inform about their hunger nor were they to express about their sleepiness. It was all understood via telepathy. Once they are born into this world, they need to express their needs by communicating. As a new parent, how you respond to the signals from the baby will indicate growth in the newborn. Crying is the only form of communication newborns know. A newborn expresses all her discomforts by crying. They cry for 3 to 4 hours in early 4 to 6 weeks. But when babies grow older and you start understanding the different cries of the baby, they spend less time crying. Newborn babies are prone to infections. Their immunity system is still developing and any exposure to infection may prove fatal too. Do not ignore these signs in a newborn and immediately rush to your doctor for help if the baby is not feeding well, if the baby is often crying without any obvious reason, if the baby is often very sleepy, if the baby often seems irritable, if the baby is breathing abnormally and rapidly, if the baby is vomiting or passing watery stools continuously showing signs of diarrhea, if the baby is often experiencing a high body temperature fever. It may take a couple of weeks for you to get the hang on to understand your newborn and cater to her needs. To avoid any sort of infections, make sure that you wash your hands thoroughly, use disposable tissues, keep your baby's environment clean, avoid taking the baby to crowded places or having unwell visitors. The baby is completely dependent on you for all her needs. Taking care of her physical and emotional needs in the initial days is your sole responsibility. Babies are sensitive and mothers are also recovering in the initial 6 weeks. Take care of your body and your newborn to avoid any sort of infections.